Hey guys, so you've probably clicked on this video for one of three reasons. Either you have PCOS, or you think you might have PCOS, or maybe you just want to see me again. Hi. I want to say hi to those of you who have subscribed. Thank you so much. And to any of you who are watching this who want to subscribe, please do. We have a lot of fun here. We will have a lot of fun here. So today I want to talk about something that's quite personal to me, PCOS. Okay, so PCOS stands for Polycystic Ovarian Syndrome, okay? And it's basically a hormonal disorder that is found in women, and it causes problems with fertility, problems with their periods, problems with their skin, and also problems with their weight sometimes. It can also put you at risk for other conditions such as type 2 diabetes. It's most common around teenagers and young women, specifically women of reproductive age. And according to the medical definition of reproductive age, we have young ladies from the age of the first menarche, which is the first period, to the age where they start menopause, and that is considered usually between 12 and 49. Symptoms can include irregular periods or completely absent periods, even when the young woman has reached the age where they would normally or should normally be having their periods. Skin discoloration, problems with the skin such as acne, hair growth around facial area or on the body, excess hair growth specifically. Sometimes some people can have balding, male pattern balding. Personally, I have some of the hair growth. When there's excess hair growth, especially on the face, is known as hirsutism. So I have some of this hirsutism, and I also have the irregular periods, the problems with my weight, and the acne. After you've spoken with the doctor and the doctor has received your past history and some of the symptoms that you're having, they will sometimes ask about your family. According to research, PCOS seems to have a genetic link. There are a set of tests that are usually done before the doctor diagnoses you with PCOS. There are three main types of tests that the doctor ends up doing. These are blood tests, pelvic exams, and ultrasounds. The blood tests that they test for your hormone levels. They usually test for your follicle stimulating hormones, your luteinizing hormone, and your testosterone. Sometimes they may also test for your anti-Mullerian hormone, and basically what they're looking for is for your testosterone levels to be a little bit high. Sometimes they may not test testosterone specifically, they may test all androgens, but your testosterone levels will usually be a little bit higher than normal. Your follicle stimulating hormone can be decreased or normal, and your luteinizing hormone will usually be elevated. What will end up happening is your luteinizing hormone will be elevated almost 3 times your follicle stimulating hormone. So your follicle stimulating hormone is the hormone that stimulates the follicles to grow and become what we know as the egg or the ovum. And your luteinizing hormone is the one that actually triggers the ovulation. So you're having a decreased level or normal level follicle stimulating hormone and an increased level of luteinizing hormone usually. Now I realized that I said testosterone levels will be higher in women, not that they will be present. Women do already have some level of testosterone. It's needed in order to have normal functions of the reproductive system. The anti-Mullerian hormone is a hormone that is normally tracked in order to let the doctor know how far away you are from menopause. The level of this will be high. And the doctor does the hormone test and finds that the luteinizing hormone is increased, the follicle stimulating hormone is normal or decreased, the testosterone level is increased, and your anti-Mullerian is increased. Then they will usually take the next step to do either a pelvic exam or an ultrasound. The pelvic exam is an exam that the doctor will do themselves. They will use gloves, they will palpate certain parts around your pelvis to feel for enlargements or swellings or anything like that. They may also look inside the cervix and the vagina in order to check for any changes. Now, the pelvic ultrasound, they will basically do an ultrasound similar to what is done in women, but focusing mostly on the pelvis, the lower part of the abdomen. And there are two main types of pelvic ultrasounds. They can do an external one where they use a Doppler just like they do with pregnant women, or they can do an internal one where they insert the Doppler into the vaginal cavity in order to have a clearer view of the ovaries. With this ultrasound exam, the doctor will check for cysts in the ovaries, and it will be seen as round fluid-filled sacs found in the ovaries, and they will also check for maybe enlargement of the endometrium, which is one of the layers of the uterus. Apart from the cysts, they will also check for enlargement of the ovaries. Some people do have enlargement of the ovaries, maybe 1 to 3 times bigger than normal. Some people may have just one ovary enlarged and the other one within the normal range. Some people may have cysts in one ovary, some people may have cysts in more than one. Some people may have no cysts at all, but they do still have polycystic ovarian syndrome. Some women may be found even have fibroids as well. Some women are also found to have endometriosis, which is the inflammation of the endometrium layer of the uterus. That usually causes a lot of pain during periods, maybe extended period times, maybe a lot more bleeding than usual, especially in the case of fibroids. Now, in order for it to be polycystic ovarian syndrome, they have to find more than one cyst. If they find just one cyst, it's not polycystic ovarian syndrome, it is just a cyst, it's ovarian cyst. I'm not saying that ovarian cyst is anything less of a problem or less painful than polycystic, but they are two different diseases. After the doctor has found that you have polycystic ovarian syndrome or PCOS or PCOS, they will discuss with you what kind of treatments that are available. The doctor can usually take two paths of treatment. They can either have treatment for the cause, the etiological treatment, or they can have treatment for the symptoms. The symptomatic treatments can either be treatment for infertility, or it can be treatments for the individual symptoms such as acne or the irregular periods. Some of the possible treatments that you may be offered: ovarian drilling, which is a surgical procedure. They enter your pelvis and they basically drill little holes into the ovaries, either by laser or sometimes with a surgical tool. This, for some people, has worked, and they've been able to have regulation of their periods, and it has helped them to get pregnant, so it's helped with the infertility. Other things that can be offered to you could be medication such as the pill, especially in the case of regulating your hormones. You can be offered either the combined pill, which has got progesterone and estrogen, or just the pill that doesn't contain progesterone. For some people, this can help to regulate their periods. For others, it doesn't work as well. Another medication that can be offered to you is metformin. Like I mentioned, with PCOS, there is an increased chance of having type 2 diabetes. PCOS causes weight gain, and with weight gain, you have increased insulin resistance of your cells. The pancreas is producing enough insulin usually, but the cells are not able to take it in, and so your glucose levels increase, and usually this can lead to diabetes. Metformin is a medication usually given to people with diabetes. It helps with the insulin resistance, as well as an increase in the glucose levels, which, like I said, can lead to diabetes. You also have an increase in the insulin levels. The increase in the insulin levels can lead to an increase in the androgen levels, so the testosterone. And that basically is a whole cycle that causes further symptoms of the PCOS. Apart from being overweight, just having PCOS in general can increase or can lead to insulin resistance. We have people who are known as, we term it thin PCOS, which means they do not usually have the issues of the weight gain. The metformin is an etiological treatment because it's working to help combat the testosterone levels. A drug that could be offered to you in order to help with the infertility problem is clomiphene. Clomiphene stimulates the pituitary gland to increase the secretion of the follicle stimulating hormone, have the follicles actually being stimulated to grow, and so you actually end up ovulating, and ovulation is what is needed in order for pregnancy to occur. Another medication that can be offered is flotinide. It's an anti-androgen. Basically what it does is it blocks the androgen from being formed from the level of the adrenal cortex. We'd also be giving us some advice on how to go about hair removal. Some countries may give coupons or vouchers for electrolysis. I started having my periods when I was 11 years old. From the age of 11, I basically never had a regular period. I didn't start actively tracking my periods till I was about 16, 17. But I just always knew that it would never come around the time that it was supposed to come. During this whole journey, the main important thing that I learned is when they say 28-day cycle, that is just a guideline. Majority of people have their periods, have their cycles being longer or shorter than 28 days. It is just a guideline, overall average, okay? So for me, my cycle is actually something more like 35 to 42 days. That is my normal cycle. Like I said, I didn't start tracking till I was about the age of 16, 17, and I started tracking with an app. With the apps, there are multiple apps out there, multiple free apps out there. You input the first day you start your period, and then when you end your period, you also put, and you can track in between. So it keeps track of how many days in between each period. I was having 90-day cycles, 150-day cycles, 160, 200-day cycles, you know, crazy numbers. 28 days, 32, like I would never say that there was a time I even had the same cycle for 3 months. For 3 months, I realized, I already kind of knew, like I said, that there was something wrong, but I realized there and then at the age of 16, 17, that no, there must be something more. I'd been going to the GP and they'd not been finding anything. Weirdly enough, every time I was supposed to go to the GP or I'd have a GP appointment, that is the time my period would actually come. So, yeah, so for me, the first symptom that made me actively try and research was the hair growth on the chin. Acne could be linked with different problems and different diseases. So can irregular periods, irregular cycle could be linked with all kinds of different things. But the hair growth is one of the major signs for PCOS. Not everybody has it, but it is one of the major signs. So for me, once I started having that hair growth, I decided to start doing some research. Thing is, a lot of women do not want to mention that they're having excess hair growth on their body, but the internet, where people can be anonymous, they will say anything and everything. And so while doing some research, I think I was about 19, 20. Whilst doing research, I came across this thing called PCOS, and I was like, okay, let me have a look. Like I'm always very curious. Let me have a look at what this is saying, what this. I was checking. Okay, this symptom, this symptom, this symptom, this symptom. I was like, okay, what are the kind of tests? Hormones, blah 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 blah. It's like, okay, fine. So I went to my GP. When I went home, I went to my GP and I said to them, I think I have PCOS. These are my symptoms. Please do a hormone test. And the GP agreed, and they did a hormone test. My luteinizing hormone came out high, follicle stimulating hormone came out low, and my testosterone levels came out high. And for me, that was the yes, that was the green light. I already knew just from those levels that I had PCOS. But obviously they have to do more tests. And so they booked me for an ultrasound, a sonogram. And I went for my sonogram, and there and then the nurse showed me that, look at your ovaries, they have cysts. This one is enlarged, this one is enlarged. They both have cysts in them. I was like, okay. Thanks, great. For me, that was it. But before they even sent ultrasound to the GP or anything, I already knew I had polycystic. So for those of you who think that some of the symptoms I've mentioned could apply to you, please go to your GP. Be honest, GP or doctor. Sorry, I know not all of you are from England. Please be honest with your doctor tell them every symptom you're having. Do not be embarrassed, because the more honest you are, the better chance of actually diagnosing you with the proper disease, or diagnosing you, letting you know exactly what's going on. It could be polycystic ovarian syndrome, it could be any other syndrome, disease that is out there linked with the reproductive system. So do not be afraid, just go and speak to your doctor. After you are diagnosed, your doctor will give you one of the options that I mentioned about the treatments. I was given the option of using the pill. I tried it, it didn't work so much for me. Some of the side effects weren't working very well for me and did not make me feel good, did not help me in any way. And so currently I'm not on any medication for the polycystic ovarian syndrome. I'm just trying to maintain a healthy lifestyle and eat good food. All food is good, all food is tasty, but I mean balanced diet basically, and trying to exercise while I can, because exercise helps with insulin resistance. I've tried to decrease taking in soda, taking in fizzy drinks, taking in a lot of juice, try and drink as much water as possible, try to reduce the fast foods. One thing I've realized, and a lot of women have also realized, that when they drop gluten, when they drop milk products from their diet, it does sometimes help with the symptoms. I personally tried, I did a few tests on myself, and I found out that I have gluten intolerance, and so I try and limit the gluten that I eat, that I take into my body, and it does sometimes help with some of the symptoms. I haven't done any tests for my fertility. I have no idea of my fertility levels, whether they're currently good or they're bad or they're normal. I have no idea what's going on. I'm not married. When I'm married, I will check that out, or before I'm about to be married, I will check that out and make the decisions of my future based on those results, whether I want to try IVF, whether I want to try taking fertility medication, whatever I choose to do. That is for the future. That is something I'm trying not to worry about now. Thank you so much for watching. If you'd like to see more videos from me, then please subscribe. Please press the bell. It will notify you when I bring out new videos. If I gave you enough information, if informative enough, please like the video. If you have any questions, or are a PCOS sufferer, or would like more information, please let me know. Write a comment. Let me know down in the comments what kind of videos you'd like to see next. Have a great day. Adios, amigos.